I am Dr. Surendra Batula, medical oncologist from Hyderabad Cancer Center, Hyderabad. Today, I would like to share a few points about the oral cancers, which happens to be a major public health problem in our country. Oral cancers include cancers of the lip, buccal mucosa, floor of the mouth, hard palate, anterior two-thirds of the tongue. So these are some of the parts which are included as oral cancers. In our country, in a developing country like ours, oral cancer happens to be the top three, comes under the top three cancers in our country. And it happens to be the number one killer disease once it is diagnosed in individuals. India is considered to be the global capital for oral cancers, as it shares 1/3 of the global oral cancers. As per the cancer statistics, 20 people are affected per 100,000 population with oral cancers. In India, oral cancer accounts for 30% of the total cancer types. And it is also said that every hour, over 5 people are dying because of oral cancers. And it is common in the central part of the India, followed by the western zone, as well as the northeastern zones in our country. So that these are the common areas wherein this oral cancers are rampant is seen. Unfortunately, this cancer is again commonly affecting the lower income groups due to lack of knowledge and awareness about the risk factors and the side effects of the commonly used chewing of tobacco, gutka, kaini, excess consumption of alcohol, human papillomaviral infections, poor oral hygiene, sharp teeth, or ill-fitting dentures. These lower income group people unknowingly get exposed, prolonged exposure to these risk factors and end up with oral cancers. 2/3 of the individuals do present to the clinics at an advanced stage disease, and the possible causes for late presentation to the hospitals or to the clinics is again due to lack of awareness about the risk factors, lack of knowledge among the healthcare individuals to how to identify the cancers at an early stage. So there's a need for us to educate the masses regarding the risk factors, their warning signs, and diagnostic facilities to be available close to the vicinity. So these are some of the reasons why oral cancers are again causing huge financial burden, not only to the individuals and the families, even to the national burden also. When compared to the developed countries, there is an increased mortality in a developing country like us. The common reason is again late presentation of the patients to the clinics with an advanced stage disease. When diagnosed with an advanced stage disease, the treatment remains questionable or less beneficial to the people. And the treatment of oral cancer leads to huge financial burden both to the patients and the family members. And unfortunately, due to this financial huge lacuna and huge burden on the family members, most of the patients end up terminating or stopping the treatment midway, which again leads to further increase in the mortality of these patients. Early detection has to be educated to the masses as well as to the healthcare workers or healthcare individuals, so that when detected early, less treatment with less trauma and less cost, we can achieve successful treatment even to the extent of cure. And when it comes to the treatment of oral cancers, the standard of care is again surgery followed by radiotherapy when it comes to the local disease or a localized disease. In a developing country like ours, with huge financial or huge disease burden, prevention, early diagnosis, and timely treatment are very important. There is a need for us, healthcare individuals, to bring awareness among the people, the population about the risk factors, causes, and fatalities of the oral cancers. There's a need for us to educate the masses regarding the importance of quitting tobacco, alcohol, and maintaining of oral hygiene. So this is again a very important disease. Very often, as I mentioned, seen in lower income group individuals. It has to be taken serious steps to be taken in order to give understanding to these people so that they can avoid the risk factor causing products which are cheaply available in our society and prevent the occurrence of disease. One individual affected with this particular malignancy is a huge financial burden to the entire family. So there's a need for us to educate the masses to control or to prevent usage of the tobacco and its products, avoid or quit tobacco and its products, and to lessen or to decrease the consumption of alcohol and to maintain oral hygiene. These are some of the important things which needs to be educated to the masses.